Sure what button to pick. Good morning. I'm here to argue for another role for patients as citizens who are helping to define the principles and values that should govern our most challenging policy dilemmas. And I'm going to use the term citizens and public interchangeably, meaning the collective or social perspective rather than the individual perspective. So why is a social perspective needed now? The public certainly has plenty on its plate trying to absorb the role of patients. To illustrate, I'm going to give you an example of something that came up in the 1990s, a real pharmaceutical breakthrough. There you go. Okay. So I'm sure you guys all recognize this. So when Viagra was introduced in, I think, the mid-1990s, erectile dysfunction went from being a personal annoyance to a ubiquitous medical problem. And Kaiser Permanente, interestingly, took a bold, as it turns out, futile stand, saying that it wasn't going to cover it. And in its explanation, Dr. Sharon Levine, who's a national Kaiser leader, testified, "We must ask ourselves when astronomically expensive new drugs for toenail fungus, afternoon drowsiness, and hay fever come to market at the same time as expensive drugs for conditions that threaten life and cause serious disability. Will we be able to create a social consensus on how to balance the costs of each with the benefits derived? Or will we simply avoid responsibility until the entire insurance system comes crashing down around us?" While all the ills of the healthcare system cannot actually be foisted onto erectile dysfunction, this example illustrates the difficulty of saying no to anything that's new in healthcare. What makes healthcare particularly relevant as an issue for a societal perspective is because it is highly individualized and personal to each particular person, but it is paid for communally. When there are more options than resources, as there always will be in healthcare, then whatever standards are applied should be based on an understanding of social priorities. But how do we begin to understand those priorities? We have many ways in this country, you know, of getting public input. I certainly can't elucidate them all. And they're all important and they're all necessary. But this type of town hall meeting, say, is definitely public input, but it's definitely not public deliberation. What we need by deliberation really is the societal version of shared decision-making. But with a lay public that sees itself first and foremost as patients and family members, can people switch roles? Can they actually reflect on their inner patient and try to come up with what is acceptable as an outer citizen? And you can imagine that some of those challenges would be formidable. I want to briefly go through what I see as sort of the different roles. How do we articulate the role of the individual as a patient decision maker and the role of the citizen as a societal decision maker? So as you know, obviously the chart on the left has a number of characteristics that I think all of you are familiar with. The individual, in deciding among treatment options, considers all the treatment options that are available, considers the benefits and burdens to them as an individual, looks at the impact on themselves and their family, reflects on their personal goals and values and the extent to which their treatment options will meet those goals and values, and ultimately their decision is what is in my best interest. But that same person acting as a citizen and trying to look at what is going to impact the many rather than impact the individual has different role entirely. So in this case, they're not looking at necessarily individual treatment options, but looking at different policy options that deal with a particular healthcare issue, needs to consider the trade-offs among those options, is informed by other people's views. Because if there's a societal perspective, then it's never about the individual by themselves. We actually don't often know what our own views are when we look societally until we start talking to others who look like us. So it's rather than patients like us, it's citizens like us. And the goal, of course, is what are those societal values that we're trying to achieve if, in fact, we need to make these difficult decisions. Because all decisions being made here from the societal perspective, all have trade-offs. They all have tensions embedded in them. So whatever you pick, someone else is going to disagree with it, is going to be wrong on one hand and right on the other. But at the end, the decision is what is in the best interest of all of us. I want to point, you do have your package of information online that has all the various materials. And of course, I want to call out to you in complete self-interest. On page 182 of your booklet is a chapter on public deliberation that was in the Essential Benefits report that was put together as part of the implementation of the ACA, and I would urge you all to memorize it. Okay, so what are the kinds of topics that we're talking about that are related particularly to coverage and cost? Not all of public deliberation is about money. There are many other issues that are involved in healthcare, but right now money is a very big one. So here are examples of projects we've done over the last few years. Should the cost of a treatment ever be a factor in treatment or coverage decisions? We did a project with Medicaid beneficiaries in California and asked them to figure out how to cut 15% out of the budget, which is what the governor was facing several years ago, and every year since then, of course. Uninsured Californians design a basic benefits package. We did this pre-ACA. I don't think the government necessarily took our report. They might well have. But we wanted to find out, what does basic mean? How is basic different than not basic? What are those characteristics of healthcare that are so critical that they absolutely must be covered, and which ones should not? And a project we did last year on the principles of a fair cost-sharing model that we did on behalf of the California Exchange. So what I want to do is just, because there's no way to give you answers to all these, what people said, but I captured just a few of the quotes that came from a number of these different projects to give you an illustration of how people actually react to this role. Putting our personal experience aside, because there's a lot of stuff on there that I personally wouldn't use, but we're talking about the working people of Sacramento. So here is someone, and by the way, they were using a process called CHAT. I think some of you may be familiar with. It's a computer simulation that we have used a lot in helping people decide what a healthcare coverage should really look like when there are more options than there are resources. But what you've got here is the recognition, and this doesn't come quickly, of someone who realized, well, wait a second, if we're sitting here trying to decide it for a much larger group of people, then what I want may not necessarily be the most important thing, and it's time to think about what other people want. Another quote, I think when you're designing it for the whole state, then you have to look at not just individuals, but everybody combined. I mean, this is a breakthrough in thinking. Most people don't know that, in fact, insurance coverage is has to do with pooled risk. Everybody puts in. Some people take out a lot. Some people take out a little. Most of the public thinks health insurance has their name written all over the dollars in there that go to them. So the fact that they are sharing these resources, and that means one has to look at the needs for everyone, is a critical insight. I have real mixed feelings about it. It's very expensive and it only happens to a few people, but if it's someone that you care about, it is the biggest deal in the world. And of course, here we're talking about the tension of, wow, do we spend money on something that affects very little people and very expensive, or is it better to spend it on something where a lot of people use, but maybe they could afford it individually? So a lot of that tension of what is fair when in fact you can't get everything. I'm just stating why I would want it. We don't have to vote for it, but still, I just want to be heard. This one I really love, because what happens in processes like this is that not everybody gets what they want. And it's a communal process of making a decision of what is fair. And when you have someone who says, I get it, I'm not going to get my way on this one, but my opinion is important and it counts, and I want to make sure you know what that is. And that is extremely powerful when people decide afterwards whether, that this process was something that they could live with. I want to make one point about the project we did with Medi-Cal beneficiaries in California about cutting the budget 15%. This was the most uncomfortable project I had ever done, because I thought we were going to be strung up. To go to actual beneficiaries and say, okay, using this chat process, take 15% away from what you've got now. and worried that people would just walk out, that they wouldn't want to participate. That was not their response at all. And one of the last questions we asked on a survey question afterwards, if the Medi-Cal budget is cut, I think it's important for Medi-Cal users to have a role. And obviously, 89% agreed strongly. Give us a voice, not just our advocates. And there are many consumer advocates whose voices are very important, but the fact that they want to have a voice themselves if something's going to impact them directly. Current issues, unfortunately, I don't have time to go over them. There are lots of issues now that are just ripe for civic deliberation. And I just want to mention the last one because that's one we're doing. Revisiting Medicare benefits. We're starting this project statewide in California to relook at the way Medicare is designed and what it serves and what it doesn't serve. And we've got 20 organizations working with us on this project. I have a handout and a small number of copies, and happy to give them for anybody who's interested. We'd welcome other states as well to join in this if you want to learn more about it. And last quote, the wisdom of the masses. If these decisions were easy, we wouldn't be here. Thank you.